It was a very distressing clinical case for me because I felt at the end of the day that I hadn't done the best I could for this particular patient. And I think all clinicians, we want to do the best for our patients at all times. And so it was a reflective exercise for me to look back and say, what could I have done better? Where are the problems? And what do we need to do about it? Leo was a gentleman that I saw for his nerve pain, neuropathic pain. And we worked really hard over the course of the 5 months that I cared for him to try and get that pain under control. But nerve pain is a very complex and very difficult, very challenging type of pain to manage. And unfortunately for Leo, he fell into that very small percentage of people that, regardless of what we tried, it just wasn't very effective.
What was it about this particular case that really made you sit back and have a second thought?
I've had many patients who, over the years of doing palliative care, who have suffered pretty difficult deaths. The vast majority we're able to really help with, and that's what keeps me in this business. But about Leo, I don't know. I think, for one thing, I really liked him. I just really liked him. We got along very well. We had a really good relationship. I think he trusted me. I got to know him and his family. And I think the fact that he was such an intensely private person and his death was so public, and it didn't need to be that way, that there had been options. Many people still don't understand what the option of assisted dying is, whether they qualify for it. There's all sorts of rumors out there about what it is and what it is not. And I suspect that Leo likely felt the same way, didn't have the information, didn't know whether or not he could approach me about it. Perhaps he was one of those people who thought, if the doctor doesn't raise the issue, then maybe I shouldn't. I don't know. The tendency seems to be to really wait until the patient raises the issue. And that raises a number of questions and concerns for me. That there might be people like Leo who could avail of that option if they knew about it or it was offered to them. And for whatever reason, and there could be lots of different reasons why people don't ask about it or don't even think about it. So that's a missed opportunity. And yet, on the other hand, you have the potential to do harm by raising that question. And I have worried about, when I have discussed since Leo with some patients, and I have said, well, here are all your options, and one of those does include medical aid in dying, that some people do take great offense that somebody would even say that to them.